Introduction to blood coagulation pathway. Blood coagulation is a complex process that helps stop bleeding. It involves the intrinsic and extrinsic pathways, as well as a series of coagulation factors and platelets working together. When a blood vessel is damaged, the body initiates a cascade of events to form a blood clot. Vasoconstriction – the blood vessels around the cut squeeze or constrict to reduce blood flow to the area. This helps slow down the bleeding. The intrinsic pathway is activated within the blood vessel, while the extrinsic pathway is activated outside of the blood vessel. Both pathways lead to the activation of various coagulation factors, which work together to convert fibrinogen into fibrin, a sticky protein that forms the structural framework of the blood clot. Platelets also play a crucial role in the coagulation process by forming a plug at the site of injury and releasing chemicals that promote clot formation. Platelet activation – platelets, which are small cell fragments in your blood, stick to the site of injury and become activated. Think of them as the first responders. Formation of platelet plug – activated platelets clump together to form a temporary plug at the site of injury. This plug helps stop the bleeding. Intrinsic pathway. Intrinsic pathway – the intrinsic pathway is initiated by damage to the blood vessel wall itself. It involves several clotting factors present within the bloodstream. The process begins when factor 12 Hagemann factor is activated by contact with exposed collagen in damaged blood vessels. Activated factor XII then triggers a cascade of reactions, sequentially activating factors 11, IX, and 8. Factor 8 serves as a cofactor for factor IX activation. Activated factor IX, in combination with factor 8 and calcium ions, activates factor X. Extrinsic pathway. The extrinsic pathway is triggered by external trauma that damages tissues surrounding blood vessels, such as a cut or injury. Activation of tissue factor initiates the extrinsic pathway and triggers the cascade of events leading to blood coagulation. Tissue factor, factor 3, which is normally not exposed to blood, is released from damaged tissue cells. Tissue factor forms a complex with activated factor 7, factor VIIA. This complex activates factor X directly. Amplification of coagulation, resulting in the formation of thrombin. Common pathway – both the intrinsic and extrinsic pathways converge into the common pathway at the activation of factor X. Activated factor X combines with factor V and calcium ions to form the prothrombinase complex. The prothrombinase complex converts prothrombin factor 2 into thrombin factor IIA. Activation of factor X, conversion of prothrombin to thrombin, essential for clot formation. Thrombin then converts fibrinogen factor I into fibrin insoluble fibrin strands, which forms the framework of the blood clot. Factor 13 stabilizes the fibrin clot by cross-linking fibrin strands. The final result is the formation of a stable blood clot that seals the wound and stops bleeding. The three pathways make up the classical blood coagulation pathway. Medical scientists must understand the involvement of calcium ions and phospholipids. A protein present in blood, essential for blood clotting such as fibrinogen, important of the factors and platelet in the cascade. Understanding the interplay between the various factors and pathways is crucial for managing coagulopathies and developing targeted therapies. Coagulation. Common diseases and factor-responsible hemophilia A is caused by deficiency of factor 7. Hemophilia B, Christmas disease, is caused by deficiency of factor X. Von Willebrand disease caused by deficiency of von Willebrand factor. Factor V. Leiden thrombophilia caused deficiency of factor V. Hemophilia C, Rosenthal syndrome, is caused by deficiency of factor Xi. Hemophilia with inhibitors against factor 8 or X. Factor 2 deficiency. Prothrombin, caused by lack of factor 2. Prothrombin. Factor 7 deficiency caused by lack of factor 7. Factor X deficiency caused by lack of factor X. Factor 13 deficiency caused by lack of factor 13. Thanks for watching. I will catch you in the next video.